Amy and Marcia go ahead and do their demonstration for us and go over the things that we need inside the room and outside the room. And then Amy, can you also go over what we need inside the room and outside the room so everybody is aware of that as well?
Hi guys. Didn't know I was going to be videoed today, so no, just kidding. So what you need inside the room is you want to make sure that you have the gloves to your size. You want to make sure you have either purple wipes or bleach wipes because you're going to be cleaning the door handles and the hand sanitizers. So you want to make sure those are in there. Outside the room, you need to make sure you have a doffing pad. You can use a chuck. You want extra gowns. You need to make sure you have extra chucks, nitrile gloves, mask, trash can, hand sanitizer, and cleaning solution with cloths to make sure that you can clean down your papers and your equipment.
Can you explain the trash can on the outside of the room and what's that for?
Yes, so when you doff, getting ready to come out of the room, when you doff, while you are inside the room, you're going to doff your gown and your gloves. That's why you have to clean the door handles first before you come out. So you're gonna doff your gown and your gloves, exit the room. So when you exit the room, the only thing you should have on is your eye gear, your N95 mask and your yellow mask on top of it, or your PAPR. So the only thing that you are wearing outside the room is your respiratory gear and your eye protection. Once you come out of that room, you're gonna immediately drop your eye protection into a bucket to be cleaned. Then you're gonna sanitize your hands, remove your yellow mask, sanitize your hands again, go wash them with soap and water, and then remove your N95. Then you're gonna go wash with soap and water again. And we're gonna demonstrate that for you, Marcia and I will.
Okay, perfect.
All right, so hold that thought.
Are we gonna do it right here?
Yeah.
You want us to do it right here?
Yeah, right
Okay.
here, please.
Do we have all?
We got to go behind.
Yeah, hold on. All right, you want me to do it or do you want to go? All right. Go ahead, Marcia. We're gonna put this on. So this one's a little different than the other ones.
So what's the difference between the yellow and the blue?
I don't know.
Just the material. And the blue ones are easier to pull off on yourself.
Okay.
So we're gonna wear, what size do you wear, medium?
Medium.
So we're gonna have her gown on, and you don't have to have gloves on. 2 pairs of gloves on. Let me reiterate what I just was getting ready to say. You don't have to have 2 pairs of gloves on, but you need a minimum of 1. If you're gonna do any additional procedure in the room, then just like you would go into a room and put gloves on to do any skill, this 1 pair of gloves that you have is going to act as your skin. So when you go into that room, if you're going to do any skill, you put an additional pair of gloves on top of them. And then those can be changed if they're soiled, and you can hand sanitize those second pair of gloves. Okay. So we got your gloves, we got your gown, we got...
This was gonna say you got a pair.
I'll wear yours.
Everybody looks jaundiced in mine. But we got your eye protection, and then she would have an N95 on under that mask. We don't currently have her N95. So with her N95, her yellow mask over top of it, her goggles, her gown, and gloves. There's no need for a hairnet, and there's no need for booties. What we're finding is that people are putting booties on, but they're not changing them between every patient encounter, and they're not removing them before they come out of the room. So you're just tracking anything from that positive patient's room everywhere else that you're walking. So it's more concerning to wear booties than it is to not. If you worry about your shoes, when you come out of the room, you're standing on your doffing pad, take one of your cloths with your green solution, a bleach wipe or a purple wipe, and you can just wipe down the bottoms of your shoes while you're standing on that doffing pad. That's going to be more effective than if you wear those booties everywhere in this unit. Okay? So then Marcia would be ready to go in, take care of her patient. What is, oh, yeah, Doffing pad, thank you. What is important is that when she goes in there and she's taking care of those patients, she's gonna hand sanitize in between every skill. So if she goes in and she programs that IV pump, she's gonna go over and hand sanitize before she goes back over and empties the Foley. She's gonna change her gloves, the outer gloves that she put on to touch that Foley. She's gonna hand sanitize those inner gloves before she goes back and does her assessment. If she's using a disposable stethoscope in the room, that's gonna be a one-time use. She's gonna go in, she's gonna have it already hooked together before she touches anything. That's gonna be the first thing she does. She's gonna, and don't touch the ends of the tips that's going in the ears. Touch the bifurcation only. Place them in your ears, listen to the patient, wipe it down with purple wipes, wipe your hands with purple wipes. Then you can grab at the bifurcation, pull out of your ears and throw it away. Don't use it again, don't hang it around your neck, don't hang it in the room. You're not gonna use it more than once.
We don't
And
have
then-
purple wipes, though.
I'm sorry?
We don't have purple wipes.
You can use bleach wipes, you can use purple wipes, or you can use the solution. So if you have one bottle for the unit or two bottles for the unit, it's okay to take a basin and put some in it and put some of these towels in it and leave it inside the room, and you can use those. So when Marcia is ready to come out of the room, she should have placed a doffing pad. If it's a rule out and there's no spotter, she's gonna place her own doffing pad before she enters that room. Maybe we should go this way so he can see you record. Okay. So she has her doffing pad outside the door. If I'm spotting, it's because she is with a positive patient. If it's a rule out patient, she's gonna have to do this solo. So you guys need to make sure that if you have any questions, let us know. So when she's ready to come out of the room, she's gonna take one of those wipes in the green solution, a purple wipe or a bleach wipe. And she's gonna wipe down the hand sanitizer in the room, and she's gonna wipe down the door handle for the door. Very good, Marcia. Then she's gonna wipe her hands with that too. So she's gonna wipe her hands with that, or you go ahead and use the hand sanitizer to make sure all is clean. She's gonna discard that. Now she's gonna need to make sure while that's drying, she removes her gown and her gloves. So Marcia, what I need you to do is grab at the waist of your gown, pull straight out until the tie breaks. Okay, now drop that portion. Then you're gonna reach and grab the top of your gown about 3 inches from the neckline. Pull straight out and leave your arms extended. There you go. So what you do not want to do is when you have your gown out like this, you do not want to pull your arm out of that gown because it's going to waft everything towards your face. So leave your arms extended. You're now going to turn the gown inside out, rolling it the opposite way from yourself. So roll the gown inside out over top of your hands. There you go. You want to keep rolling it until the inside part of the gown is over top of your hands. There you go. If you're rolling it appropriately, it'll automatically pull the gown down off of your arms. So she's going to keep doing that. We call it Pac-Man. So what you're doing is pulling the gown like this, balling it up into your fist. Pulling the gown down, balling it into your fist. So it's going to pull it off of your arms. When she gets to this section, the inside of the gown is now over top of her thumbs. So the inside of this gown was clean. She can now take her covered thumb, tuck into one portion of her glove, and remove her hand from the glove. Now that's her clean hand, so she's going to take one index finger, put it into the cuff of the opposite glove, and pull it straight down and drop it into the trash. So she would have a trash can and she would just drop it straight down into the trash. Now she's ready to exit the room. So because she cleaned the hand sanitizer and the door handle, it's okay for her to hit that hand sanitizer and go ahead and sanitize her hands and open the door and exit. She's going to exit straight onto her doffing pad. Let me borrow it. So when she comes out of that room, you'll notice how we set up the room over here for the rule out. When she comes out of that room, she has a table, and there's going to be a basin sitting right on the front of that table. So what she's going to do is hit the hand sanitizer on the side of the wall. She's going to sanitize until her hands are dry. You don't want wet, sloppy hands when you're doing it. She's going to lean over top of her bucket that's sitting on that table, and she's going to put her index fingers behind her ears and push her glasses into the bucket. You are not gonna reach up and touch your face. You're gonna keep pushing the back of the glasses.
Sure you are.
There you go, and you're gonna drop them straight into that bucket. So that's gonna be sitting on your table. Then she's gonna hit that hand sanitizer again. And while she's standing there, there's a trash can right underneath the hand sanitizer. What you're gonna do is take your 2 index fingers, put under your earlobes, make a V, and remove your mask by pushing straight away and then down into the trash. Now, if she was in a positive patient room, well, a rule out or a positive, she's gonna have an N95 on underneath that. So as soon as she deposits that yellow mask in the trash, she's gonna hit the hand sanitizer on her way to the closest sink, and she's gonna wash up to the elbow with soap and water. Dry them, then she can remove her N95 mask. That's gonna be how you keep your N95 mask clean and be able to reuse it. 1, it's covered with a yellow mask, and 2, you're only removing it with clean hands. Okay? So then she's ready. If she wants, she can use those green solution and wipes, purple wipes, or bleach wipes to wipe down the sides of her shoes. She's gonna go finish washing. She's gonna come back and put clean gloves on. She's gonna take her bleach wipes, purple wipes, solution and wipes, whatever that we have available. She's gonna get her goggles out and clean them. She's gonna clean all the bins, all the nooks and crannies, and then you're gonna set it on top of a clean doffing pad on your table that's outside your door to allow for a 10-minute dry time. And then she's gonna clean her bucket and basin with the same solution and set it back up, and she should be ready to go. Now, while she still has those clean gloves on, her glasses are drying, she can come over and you're gonna roll your doff pad. So you're gonna grab the edge, fold it in on itself on each side. Don't roll it, don't wad it or anything else. You're just gonna grab with your gloved hand, pick it straight up, and then you're gonna deposit it into the trash that's sitting right next to your hand sanitizer. Don't push the trash down. Don't do anything with the trash other than drop things straight down into it. When it gets about 2/3 full, you're gonna need to change it and take it out. The trash that's either inside the room or outside is gonna need to be double bagged. So if it's inside the room, you're gonna have somebody to tag team it and help you. While you're in the room, you're gonna tie up the top of the trash. You're gonna take it out of the bag, have somebody at the door waiting. You open the door. The person who is outside waiting will hold a bag that's ready, like you're trick-or-treating. Just hold a bag ready. They do not cross the threshold of the door. They will deposit that bag into the trash, and then you'll tie it up. Then it can be taken out in the regular trash, as long as it's double bagged. Same thing with the linens. The linens need to be brought out the same way and double bagged, and then put into wherever the dirty utilities is.
So we need extra bags. We need bags, and we put extra bags on the
I have a
station a lot of
question.
Yeah.
times too.
I have a question.
What you do, Donna?
So is the hand sanitizer in your room right at the door or not? Where's your hand sanitizers in the room?
It's on the wall.
By the door though?
No, but I mean,
Okay,
you
so
can
that's
still.
what I'm saying. If they've got all this off, do they walk back into their room to use the hand sanitizer? Because they're gonna go back past the bathroom and everything over here.
How far is it from the door?
Probably 4 to 6 feet.
Other side of the curtain.
Other side of the curtain.
Yeah, some of our ICUs in High Bay are that way, and we have a pump station sitting next to the door, or a freestanding one. It is okay as long as you're not touching anything else, because you're cleaning that down before you use it. So you can go back. It's not ideal, but you want a hand sanitizer before you come out of that room.
Other questions?
If you have a pepper, I know this was for,
Oh, yeah. So if you have a papper, cleaning the papper.
Yeah, so do we have a papper to demonstrate?
we have,
Yeah, it's been washed off.
So help us clean.
So
It is, because I cleaned it.
Okay, good.
Unless it's been used against it.
So if we have the same scenario and Marcia is in the room, if you have a positive patient, remember you're going to have a spotter, so they're going to help you. If you're going to rule out, we're going to coach you through it here. So if she's in the room, she's removed her gown and gloves inside the door. She's opened the door. She's on her doffing pad. She's going to have this on with her papper. There's no way to disconnect or remove your hood by yourself. So you're gonna have a buddy that helps you. So what's gonna happen is they're gonna grab a hold of the papper that's on the lower back. You're gonna hand sanitize, and then you unbuckle the clip. They're gonna grab the top hose of the papper, so they got the papper in one hand, the hose in the other. You're gonna grab the top section at the crown of your head. On the count of 3, they're gonna disconnect your hose as you pull up, down, and away, and set it straight on your doffing pad. Then you're gonna hand sanitize. They're gonna set your papper down, and then they're gonna coach you through getting rid of your mask, your eye shield, and washing your hands, and then getting rid of your N95. Then your spotter is gonna come back and they're gonna clean your gear. So your spotter should have a mask, gloves, and eye shield on. And they can clean your gear with the purple wipes, bleach wipes, or the green solution. And so they're gonna clean that for you. And then it should be placed on a clean chuck on a table to air dry for 10 to 15 minutes before it's able to be used again.
So you said you'll still have a N95 under? Would
No,
that-
if you're sharing a papper hood, you're gonna have a yellow mask on underneath it. So if you have your own individual papper hood, you don't have to have the yellow mask. The N95 is just if you don't have a papper or you're fit tested to an N95, we would prefer you to use the N95. But you won't wear both together.
So do you collect your dirty linens and your dirty stuff before you take your gown off and hand them out, or after you take your gown off and
No, no, no. So if you're bringing out linens and trash, you are going to send those out first.
Okay.
Before you get rid of your gown and gloves. Okay. Now, if you have a COVID positive patient, EVS doesn't enter those rooms. So now you take on EVS role as well as the RN role. So you are going to clean those rooms multiple times a day and mop at least once a shift. And you need to clean with Oxyvir or Oxycide.
Which are found in,
Huh?
which are found in.
The housekeeping closets. Yeah, EVS should be able to help you with that. So inside the rooms, we leave a bucket with the solution and multiple towels. So when you're in there, after you've done your nursing skills, before you come out, we're gonna have you clean bed rails down, any hard surfaces, tables, everything. Then you throw those cloths away. You don't reuse those, you don't put them in the linens, those get thrown away. So it's gonna cut down on that viral load that's in the room so that when you're going in there, it's not building up. I do have a form that I can send you that's the spotter checklist and the RN schedule, because when we have a positive patient over in 5A, we go in on the even hours. So we have an RT and an RN that go in and they do team nursing, and they go in on the even hours.
Physicians have helped with team nursing too.
Yeah, our physicians are helping. We had Dr.
Cleaning.
Morris mopping a floor
Mopping.
the other day.
Cleaning up stool.
So they're gonna help you, they're gonna help
They're in the room,
turning.
they help.
Yeah. Currently our NCTs do not go into positive patient rooms.
Any questions?
The spotter has to be an NCT or a nurse, or it doesn't matter?
It doesn't matter, it can be anybody, but you do have to attend the training. The training class is currently an in-person class that's listed in My UK, and the title of the course is Caring for the COVID Patient. It's a 2-hour class. The first hour is didactic, the second hour is hands-on donning and doffing, how to suit someone up and how to take them out of the suit. And then you can be a spotter.
I would like that checklist so we can put it, so when we, for our rule outs, we can have it so we can kind of use it as our own checklist.
Yeah,
That we can put outside the doors and stuff and inside the room.
sure.
Other questions?
So does all employee staff has to go to this class? Like,
No,
is it
no, it's a
mandatory?
class if you wanted to be a spotter.
Spotter, okay.
Yes, yeah.
We are making a WBT with some videos that show the donning and doffing process, and it'll be in My UK for you to view, and it'll show everything that we're talking about.
Other
Just-
questions? Oh, thank you.
Just curious, currently, since we don't have anybody checked off for being a spotter, what would we do if we had a situation where we had a positive?
So we do have staff that are trained to be spotters over here. Some of the staff from the 6th floor and I believe 4 West, where their units were closed, they were doing that so that they can sign up to be a spotter. So we do have spotters. We don't currently have any openings over here because we just typically have the rule outs. Once they get ruled out, we get them a bed and they move. So that's something that, you know, we'll talk with Lisa and our DCN group about how we want to manage those for patients for the, you know, hour or two that they're here. So that's something that's on my list of things to talk with them about. Other questions?
It would really be nice if everybody got training on being a spotter.
Well, we don't have enough
Because-
capacity to do that right now. There's only, all the classes have been full, and I know they're trying to get some more,
Mhm.
so,
And
you
where
know.
it's an in-person class, we're only having 10 people per class
Right.
because
Yeah.
we're trying to keep
Yeah.
social distancing at its best.
But we-
It is an
Help you.
in-person,
Yeah.
so we're trying.
We're gonna be getting some videos out of all this stuff for you guys so that you can view it over and over.
Other questions? Okay. Thank you.
Thank you.
All right, guys,